Placenta previa is a pregnancy condition that requires careful monitoring and management. It happens when the placenta grows in the wrong place within the uterus. Specifically, the placenta grows in the lower part of the uterus, which can lead to complications. This can be dangerous for both the mother and the baby, posing significant health risks. Placenta previa can cause bleeding during pregnancy, which can be severe and life-threatening. This is because the placenta might cover part or all of the cervix, the opening to the uterus. The cervix is the opening to the uterus, and its blockage can cause complications. Bleeding can happen during pregnancy or during labor, making it a critical condition to manage. Placenta previa can make labor and delivery difficult and risky for both mother and baby. The baby might not be able to come out of the vagina naturally because the placenta is in the way. This is because the placenta is blocking the birth canal, preventing a normal delivery. If you have placenta previa, you will need special care during your pregnancy to ensure safety. You might need to stay in the hospital for close monitoring and immediate medical attention. In many cases, you might need to have a cesarean section or C-section to safely deliver the baby. Doctors use ultrasound to diagnose placenta previa, a condition where the placenta covers the cervix. Ultrasound is a safe and painless test that provides crucial information. It uses sound waves to create a detailed picture of the inside of your body, including your baby and placenta. During an ultrasound, you will lie comfortably on a table. A technician will apply a special gel on your belly to help conduct the sound waves. They will then move a small device called a transducer over your belly, which sends out sound waves. The transducer sends out sound waves that bounce off your baby and placenta. These sound waves bounce back as echoes, which are picked up by the transducer. The transducer sends these echoes to a computer, which processes them. The computer then creates a detailed picture from the echoes, showing the position of the placenta. Your doctor will carefully review the ultrasound picture to determine the exact location of your placenta. If your placenta is covering part or all of your cervix, you have a condition known as placenta previa, which requires careful monitoring.
This video was proudly sponsored by Gologin, GoLogin, the best browser for multi-accounting. That was a brief moment, ladies and gentlemen. Let's get back to our video.
There are 4 types of placenta previa. The type of placenta previa you have depends on how much of your cervix is covered by the placenta. Complete placenta previa. The placenta completely covers the cervix. Partial placenta previa. The placenta covers part of the cervix. Marginal placenta previa. The edge of the placenta reaches the edge of the cervix. Low-lying placenta. The placenta is in the lower part of the uterus, but it does not reach the cervix. The type of placenta previa you have will affect your treatment and delivery options. The goal of managing placenta previa is to keep you and your baby safe. This condition occurs when the placenta covers the cervix, which can cause complications during pregnancy and delivery. Treatment will vary depending on the severity of your condition. Your healthcare provider will assess your situation and recommend the best course of action. If you have a low-lying placenta and no bleeding, your doctor may recommend watchful waiting. This means closely monitoring your condition without immediate intervention. You will need to have regular ultrasounds to monitor the location of your placenta. These checkups are crucial to ensure that the placenta does not move into a more dangerous position. If you have a more serious case of placenta previa, or if you experience bleeding, your doctor may recommend bed rest. This helps to reduce the risk of further complications. You may also need to stay in the hospital for closer monitoring and immediate medical attention if necessary. Most women with placenta previa will need to have a cesarean section or C-section. This is often the safest way to deliver the baby. This is a surgical procedure to deliver the baby through an incision in the abdomen. It is typically planned ahead of time to ensure the best outcomes for both mother and baby. If you have been diagnosed with placenta previa, it is important to follow your doctor's instructions carefully. Adhering to medical advice can significantly improve your pregnancy outcome. With proper care, you and your baby can have a healthy pregnancy and delivery. Always communicate with your healthcare provider and attend all scheduled appointments.